Good afternoon. Welcome everyone to the 2016 Building Better Health pre-conference webinar, ACA 101, Everything You Wanted to Know But Were Afraid to Ask. My name is Liz Tansey. I'm the Outreach and Enrollment Coordinator at Colorado Covering Kids and Families and your chairperson for today's webinar. We're going to go ahead and get started with some housekeeping notes. Our webinar today is being recorded so that others who could not attend can watch the presentation later. Next week, you'll receive a link to this webinar as well as a PDF presentation that we'll go over today. We'll also post the recording and the presentation on the website www.coloradohealth.org. In order to minimize background noise, your phones are all muted and in listen-only mode during this presentation. And the final portion of our webinar is devoted to questions. So please feel free to send your questions in through the chat function at any time throughout the presentation. You should see a chat dialog area located at the lower left-hand side of your screen where you can type your questions and send them in. You will also see a raise hand button, but we will not be using that during this feature or during this webinar, so please do not click on that when asking a question. If you have any technical difficulties during the webinar, please call ReadyTalk's toll-free technical support number at 1-800-843-9166, and you'll see that on your screen now. Make sure that you have your registration confirmation available if you need to call that number. Finally, after the webinar is concluded, you'll have the opportunity to give us feedback through a short survey, and we ask that you please take a minute and complete this survey, which will help us improve future presentations and the Building Better Health Conference. Today's presenters are Linda Gann with Connect for Health Colorado and Nina Schwartz from the Colorado Department of Healthcare Policy and Financing. Linda is starting her 4th year with Connect for Health Colorado and is currently the Senior Manager of the Western Slope region. And she works collaboratively with brokers, health coverage guides, and certified application counselors to bring access, affordability, and choice to Coloradans. She also serves as the Social Media Manager and Tribal Liaison for Connect for Health Colorado. Nina is the Eligibility Communications Specialist for the Department of Healthcare Policy and Financing. I'm now going to hand it over to Linda.
Hello, everybody. I'm happy to present Affordable Care Act 101. It's been a very interesting 5 years for those of us involved in the work. And my first slide, I think, brings context to the whole conversation about healthcare costs. In other words, why are we going through all of this? As people try to understand the evolution of healthcare in our country, I think this slide helps establish the pattern of costs that has continued to rise under the system that we had prior to the ACA. For instance, if you look in 1970, the average per person expenditure for healthcare was about $300, and by 2010 that had risen to over $8,000. So clearly we had a problem with escalating costs and something needed to be done. The other problem that was happening during this time was cost shifting. According to the Center for American Progress Fund, when the uninsured cannot pay for their care, healthcare providers shift those costs to those who can pay. In other words, those who have insurance. This leads to higher premiums for those who buy their insurance on the individual market, as well as workers who get their insurance for themselves and their families through their jobs. This hidden tax on health insurance accounts for roughly 8% of the average health insurance premium. This table shows the result of that cost shifting and the impact on premium costs in 2005 and again in 2009. Colorado has been working on this for many years. In addition to the rising cost of care, many citizens were uninsured for a variety of reasons, including not having access to employer-sponsored coverage, or they had a pre-existing condition which would let insurance companies deny them coverage at any price. Many federal administrations, along with many state governments, have tried to develop policies that would start to rein in the high cost of care in the United States. Colorado has been a leader among those efforts. Governor Owens, a Republican, decided to do something about it. In 2006, he established a Blue Ribbon Commission. That commission was diverse and included Republicans, Democrats, people in the healthcare industry, and community advocacy groups. There were 27 members in all. They worked for over 2 years, and there was strong disagreement at the beginning of the process. But through diligent efforts and compromise, 24 of the commissioners ultimately signed off on the recommendations. The preface of the report that they published stated that the fact that such a diverse group representing a broad array of backgrounds, ideologies, and interests was able to come to agreement on these recommendations signals that real reform is indeed achievable. The entire report, as well as an executive summary, is available online, and the link is provided on this slide. But what I'd like to do is call attention to the date that this report was submitted to the legislature. It was January 2008, which was 10 months before the presidential election that year. At the time this report was presented, we didn't know who was going to win. There were primaries for the Democrats or Republicans, and we certainly didn't know who was going to be president in November. The report contained many recommendations. Among the strategies in the report was the idea that all Coloradans needed to be covered. By extending insurance coverage to more Coloradans, we aim to minimize the hidden tax of uncompensated care, stabilize rising costs, and improve Coloradans' health. Their document laid out their strategies for how to get that done. Among the key recommendations included individuals have responsibility for their own health and wellness. The government, employers, and insurers should promote and encourage healthy lifestyles and preventive care. This third bullet is pretty interesting to me. It says that this group said that we should require all legal residents of Colorado to have minimum insurance coverage. In other words, an individual mandate by expanding eligibility in public programs, providing sliding scale subsidies based on income, requiring health plans to cover everyone, and enforcing this mandate through the income tax system. Does that sound familiar? I mean, it's amazing to me when I think about what Colorado did from 2006 to 2008, and then what ultimately our entire nation has adopted. It does show that Colorado is a leader. But as we all know, 10 months later, Barack Obama was elected president. The first 2 years of his term were spent crafting the Patient Protection and Affordable Care Act, or better known as the ACA or Obamacare. These 2 years were as divisive at the federal level as Colorado's Blue Ribbon Commission was in our state. There were many who wanted a single-payer system. Some wanted the creation of state-based marketplaces, similar to Massachusetts. Others wanted to expand Medicaid nationally to all low-income residents, or others still to let the states, not the federal government, decide what to do with Medicaid. After 2 years of negotiations, the Affordable Care Act was signed into law, which provided that states could build their own marketplace, but if not, they would become part of the federal system known as healthcare.gov. While we are all most familiar with the first two titles of the Affordable Care Act, I put this slide in because I think it's important for all of us to understand the complexity of this act. Title I is the Affordable and Available Coverage. Title II is Medicaid and CHIP. Title III is the Delivery System Reform and Medicare. Title IV is Prevention, Wellness, and Public Health. Title V, Workforce Initiatives. Title VI, Fraud, Abuse, Transparency, and Other. Title VII, Pathways for Biological Similars. Title VIII, Community Living Assistance Services and Supports. Title IX, Revenue Measures. And finally, Title X, Managers Amendments. So you can see it's a very complex act, but we spend most of our time on Title I and Title II. So this map shows all of the states that decided to build their own marketplaces. The dark blue states are the ones that decided to build their own, Colorado being one of those. The light blue states did not build their own marketplace. Instead, they became part of healthcare.gov. The medium-colored blue states have developed some sort of partnership with the federal government. The interesting thing to keep in mind as we go forward is that even though the dark blue states all built their own marketplaces, each of us did it a little differently, and that was the flexibility that the law gave us. So Colorado, I think because we're a purple state, came together with bipartisan legislation that was passed in May of 2011 that created the Colorado Health Benefit Exchange. This legislation provided the framework for Connect for Health Colorado. After that, as we all know, there was the Supreme Court challenge. The first major challenge came to the Affordable Care Act in 2012 in a case of the National Federation of Independent Business versus Sebelius, which centered on the constitutionality of the individual mandate and denying states funds if they did not participate in expanding Medicaid. In a 5-4 decision, the court ruled to uphold as constitutional the Affordable Care Act, including the individual mandate, requiring virtually all Americans, except for those who might qualify for an exemption, to enroll in health insurance coverage. The mandate is upheld based on Congress's power to tax. The court deemed the required expansion of Medicaid under the Affordable Care Act was also constitutional, except for the provision that threatens loss of existing Medicaid funds for states that do not participate in the expansion. In other words, Congress may offer additional funds under the Affordable Care Act to states that chose to expand Medicaid eligibility, but they may not withhold existing federal funds for Medicaid from states that chose not to participate in the expansion. So what are some of the key provisions of all marketplace plans? All marketplace plans now must have the 10 essential health benefits, in other words, comprehensive coverage. What happened before the Affordable Care Act is some people thought they had coverage because they clipped out a coupon in the back of a magazine and sent off $100 to Kansas. But what happened was they found out when they needed care, an ambulance, or hospitalization that it wasn't covered. So that's really important that all plans now have comprehensive coverage. Another key provision is that consumers can no longer be denied health coverage based on a pre-existing condition or their health history. In fact, those questions are not even asked. Children can stay on their parents' plan until they turn 26, and a consumer's insurance company can no longer drop coverage if you get sick. Also, that before the Affordable Care Act, if somebody did have insurance and then unfortunately had some sort of catastrophic health event, the insurance company that had been covering them could literally drop them just when they needed it the most. And then another key provision is that insurance companies are held accountable for rate increases. The 80-20 rule generally requires insurance companies to spend at least 80% of the money they take in on premiums on your health care and quality improvement activities instead of on administration, overhead, and marketing costs. The 80-20 rule is sometimes known as the medical loss ratio, or MLR. If an insurance company uses 80 cents out of every premium dollar to pay for your medical claims and activities that improve the quality of your care, the company has a medical loss ratio of 80%. Insurance companies selling to large groups, usually those more than 50 employees, must spend at least 85% of their premiums on care and quality improvement. If your insurance company doesn't meet those requirements, they'll be required to rebate back to you some of your premium. So we mentioned the 10 essential health benefits, but here is what they are. Ambulatory patient services. That means care in urgent care facilities, basically anything outside of your doctor's office but not in a hospital. Emergency services, hospitalization, maternity and newborn care, mental health and substance abuse is now part of the 10 essential health benefits, does not have a separate deductible. Prescription drugs, rehabilitative and habilitative services and devices, laboratory services, prevention and wellness, and chronic disease management, pediatric services including oral and vision care. So as you can see, this is very comprehensive coverage. Affordability. Marketplace enrollment is the only place where consumers can access new tax credits to offset the cost of their monthly premiums. Before I go on, I think it's important for people to understand that most people get their insurance from their employer. And for 60 years, employers have received a tax consideration in that they don't have to pay payroll tax on the value of that health benefit that they provide their employee. And the employee on their side does not have to pay income tax on the value of that health insurance premium that their employee pays. And that's a significant tax consideration that large employers have had for 60 years. So marketplaces are now able to bring a tax consideration to the individual market. Medicaid will now be available to more Coloradans, and as we all know, Medicaid is now Health First Colorado. Health insurance plans with lower copays and deductibles are now also available to certain individuals and families who earn over the Medicaid or Health First Colorado guidelines. We have a slide coming up that will show you those guidelines. So Connect for Health Colorado is an open, competitive marketplace for individuals and small employers. What that means is we do not tell insurance companies what plans to place where. We are completely open and competitive. In other words, health insurance companies in our state can decide if they want to place plans across the state in certain regions, what those plans will look like, as long as they contain the 10 essential health benefits, of course. And they price those. Then health insurance companies send those plans to the Division of Insurance in May. The Division of Insurance spends all summer looking at those plans to determine if they meet the letter of the law. And if they do, then they send them to us, and we load them in our marketplace that then allows the consumer to shop for insurance similar to Travelocity when you buy when you buy an airline ticket. In other words, you can shop for plans that contain the same benefits. You go into our marketplace, you put in information about you, your zip code, your age, and then at the end of that very short determination, you'll see the plans that are available in your region and how they're priced. So you can actually compare apples to apples in determining which plan is better for you. This third bullet is just critical for people to understand about Connect for Health Colorado. We are the only place where consumers can access these federal tax credits. If a consumer buys a Rocky Mountain Health plan outside the marketplace, it's the very same plan, the very same design, and they qualify for the tax credits, they will not be able to get the tax credits. So it's very important. All of our health coverage guides, brokers, and application counselors are trained very clearly on this, that consumers must go through the marketplace in order to capture those tax credits. The fourth bullet, we have a free assistance across the state. People can call an 800 number Monday through Friday, 8 to 5, basically during open enrollment. We have extended hours. We have a chat feature on our website, as well as sitting down with trained representatives for help. And all of this help is free, no cost to the consumer. And then finally, ultimately, the goal is that our citizens, our consumers, will pick a plan that best fits their family. So Connect for Health Colorado is not a health insurance plan. In other words, our consumers don't get a card from us that says, here's your Connect for Health Colorado health insurance card. We help consumers find the right plan in our competitive marketplace with the insurance companies that are available. When they make their selection, their relationship is directly with that insurance company, whether it's Anthem, Cigna, Rocky Mountain Health Plans, or whatever. Once we help them find the plan that's best for them, that's their relationship. That's who they call if they have a question about their coverage. That's who they'll get their insurance card from. We are not a replacement for the current market or brokers. In fact, we have over 1,000 certified brokers who have taken our certification class to sell products through our marketplace. We are not engaged in negotiating the rates between insurance companies and healthcare providers. We don't sit at that table. We're not part of our state's Medicaid or Health First Colorado program. We do very much have a no wrong door policy. If a consumer comes to us and through the initial determination we determine that they're Medicaid eligible, we'll help them enroll in that program. So we're happy to work with our partner at State Health First Colorado, but we are not part of Health First Colorado. We don't offer Medicare health plans or Medicare supplement plans. Those are for people over 65. We don't have those as yet. We're not a government health care system, and we're not a state agency or a regulatory body. We're not part of the state of Colorado. We are a quasi-nonprofit established by state legislature, but we are not a state agency. And we are not an organization that receives any funding from the Colorado General Fund. So I mentioned our experts before, but this gives you a little bit more background of who they are. Once again, it's important to understand that none of our experts charge any money for the services that they provide. Our certified brokers play a critical role in Colorado coverage. Last year, and they enrolled over 50% of our enrollments. Brokers receive a commission directly from the insurance company. They are not paid by Connect for Health Colorado, but they are also trained to advise consumers on the health plan to pick. For instance, if the next category is certified health coverage guides. Health coverage guides, application counselors provide outreach and education. They can help consumers go through the eligibility process to determine their financial tax credit level. They can help consumers enroll. But if they get down to that last page and the consumer is looking at 3 or 4 different health plans and they say something, for instance, well, I don't know which plan to pick because I've got a special needs child, our health coverage guides and application counselors cannot provide that type of advice. That's when they are trained to refer to brokers in our region. Brokers can do that. Brokers have that higher level of training where they can advise a customer on which plan is best for their family-specific needs. And then finally, we have a trained customer service center staff, an 800 number that is available, as I said, Monday through Friday during off-open enrollment, and during open enrollment, extended hours, sometimes 7 days a week, and sometimes 12, 14 hours a day. So those application counselors do a good job, the customer service center does a good job of answering questions for brokers, health coverage guides, and consumers. So now I'm going to pass it off to our colleague, Nan, in the healthcare policy and financing part of this whole Affordable Care Act conversation.
Thank you, Linda. As you heard at the beginning of the webinar, my name is Nina Schwartz, and I'm the Eligibility Communications Specialist for the Colorado Department of Healthcare Policy and Financing. At Healthcare Policy and Financing, our mission is improving healthcare access and outcomes for the people we serve while demonstrating sound stewardship of financial resources. The department oversees and operates Health First Colorado, Colorado's Medicaid program, Child Health Plan Plus, CHIP Plus, and other public health care programs for Coloradans who qualify. You've heard several references in this presentation to the expansion of Medicaid, which was one of the key components of the Affordable Care Act, as Linda outlined. As of June 27, 2016, the new name for Colorado Medicaid is Health First Colorado, Colorado's Medicaid program. The new look and name better reflect Colorado's modernized Medicaid program, including a focus on being person-centered. The new name also reduces confusion with Medicare, and it doesn't change member eligibility, coverage, benefits, changes in providers. It only applies to Medicaid and not to CHIP Plus or any of the other programs that are non-Medicaid HCPUS programs. Now I'm going to talk a little bit about how the department's programs, including Health First Colorado, fit into the larger picture of health coverage in Colorado following the implementation of the Affordable Care Act. The Affordable Care Act has had broad impacts across both public and private insurance and providers. The department works closely with other state departments on health and healthcare-related programs in Colorado. This includes the Department of Human Services, Office of Behavioral Health, working on issues administering the behavioral health and substance abuse benefits, the Department of Public Health and the Environment, working on health promotion and prevention programs, and the Division of Insurance, with whom we've worked very closely, with the Division of Insurance that regulates private insurance and certifies marketplace health plans on public education campaigns about health insurance and insurance terminology. Finally, last but not least, as many of you know, we've worked and continue to work very closely on a pretty much constant basis with our partners at Connect for Health Colorado. It's this collaboration that has allowed us to make significant progress in cutting the uninsured rate in Colorado. So you'll see on this slide that there was a survey released as of September 2015, which shows that the number of uninsured has been reduced to historic levels in Colorado of 6.7%. And this is down from 14.3% in 2013 and at its peak at 15.8% in 2011 before the Affordable Care Act was implemented. Now, while Health First Colorado covers 1 in 5 Coloradans, that's only one part of the healthcare coverage landscape. As Linda mentioned earlier in the presentation, the majority of Coloradans still have private health insurance coverage. This is true in Colorado and across the country. ACA has not reduced the number of individuals who are covered by employer-sponsored coverage. Using data from the Colorado Health Institute's 2015 Colorado Health Access Survey, that's what you see represented in this slide. In Colorado, you can see around 59% have private coverage, approximately 21% have coverage through either Health First Colorado or CHIP Plus, 12.9% have Medicare, and then it's the remaining 6.7% that are still uninsured. Since the initial rollout of Medicaid expansion and the launch of Connect for Health Colorado, the annual open enrollment period has been an important part of expanding access to coverage, and it has continued to evolve. This slide shows the coverage trends during open enrollment during the past 3 years. As you can see, the Health First Colorado enrollment was highest in the first open enrollment period when the expansion launched. Since then, the majority of individuals applying during open enrollment qualify and become enrolled in marketplace plans. During last year's open enrollment period, open enrollment year 3, there were nearly 4 times the amount of private health insurance enrollees than enrollees in Health First Colorado or CHIP Plus. So who are in this post-implementation of ACA world, who are Health First Colorado members today? So the largest portion of the Health First Colorado caseload is kids, followed by adults, individuals with disabilities, and older adults. 75% of adult Health First Colorado members are individuals who work. 76% live in cities with populations above 10,000 people. In addition to the impact that the Affordable Care Act has had on the lives of those gaining access to health insurance, the expansion has also had a positive economic impact on the state. Earlier this year, the Colorado Health Foundation published updated analysis on the economic impact of expanding Colorado Medicaid, Health First Colorado. The analysis found more jobs have been created, economic activity has increased, and average household earnings are higher as a result of the expansion. And they found that the positive economic impact is likely to continue. I'll now turn it back to Linda as she delves further into the landscape for access to health coverage today and moving forward. Thank you.
Thank you, Nina. That was great. I learn a lot from our partners, and as she said, we work collaboratively day by day with our friends at Health First Colorado. But this chart table, I guess, shows income guidelines for 2017. And what I'm going to do is just kind of walk through that top row, the family size of 1. So this would be an individual. An individual earning up to $15,800 would be eligible for Medicaid, our Health First Colorado program. Individuals who earn, an individual who earns $15,800 to $29,700 would qualify for advanced premium tax credits and cost-sharing reductions. A person who earns $29,700 to $47,520 will still receive advanced premium tax credits, but they're smaller. The advanced premium tax credits are on a sliding scale. So in other words, the closer an individual is to the $15,800, the larger their tax credit will be. The closer they are to the $47,521, the smaller their tax credit will be. And then the final column is an individual who earns over $47,521 will not be eligible for a tax credit, but they will certainly be able to purchase a highly qualified health plan. So you can see the math if you go down. We have the bottom row is a family of 6. A family of 6 earning up to $130,000 will receive some sort of an advanced premium tax credit. So this this chart and these income levels are updated annually by the federal poverty level. That's what we use. The next slide shows our website, connectforhealthco.com. This website is completely translated into Spanish. You can see the little green tab in the upper left right-hand corner. It's linguistically correctly translated. In other words, not word for word, but we spent quite a bit of time and continue to make sure that the Spanish site is linguistically appropriate. The next slide is where individuals and families would begin the process. This page is consumers are able to check and browse plans just by doing a quick zip code, typing in where they live and the number of people in their household, and pushing a button, and it literally takes about 10 seconds, and they can see the plans that are available in their area. They can also, in this, do a quick estimate on whether or not they will qualify for a tax credit. Again, those are anonymous tools just to give a consumer an idea. Once the consumer gets an idea, then they would need to go through the whole application process, and that's where our guides and brokers come in handy. The next slide is something that we don't talk a lot about, but I think it's important. We've had our small business marketplace, which is required as part of the Affordable Care Act. Small businesses, in other words, a business from 2 to 100, they're not required to offer health insurance. They won't be. There's no penalty if they don't. But they do know, most small businesses realize, if they do offer health insurance, they can recruit and retain higher quality employees. So we can sort of be the HR office for small businesses that don't have an HR office. They can tell us there's different levels of participation. The employer can tell us they want to contribute a specific amount. They want to contribute, but they don't care which plan their employee picks, for instance. So once we determine, working with the employer and almost always a broker, what the employer wants, we then work with each of their employees to find the coverage that they need. And that's really good, because the way it used to work, and the way it still does work, is that if an employer offers health insurance, it's typically one plan for all their employees. And as we know, one plan doesn't necessarily fit all. So we think that we have a real opportunity to build on this small business marketplace in the coming years. So now what I wanted to show you was a little bit about how our open enrollment 2016 looked like. As Nina explained, each year we've been able to increase our enrollment in this private marketplace, and we're really happy about that. And so I wanted to show you a little bit about who our consumers are. The largest demographic would be the individual. We have 79,000 of our enrollments are a household of one. We have 44,000 of our enrollments are a household of two. So you can see that we are really impacting that individual and the small family that never had access to coverage before. And what impact are we bringing to Colorado? We keep talking about those tax credits, and they're pretty significant. $184 million is what we were able to return to Coloradans in the form of tax credits in 2015. So that's pretty impactful economically to each of our counties, and we'll have the new number at the end of this year. We'll publish that. Open enrollment for 2016 also saw a 19% increase in the number of enrollments. Each of our counties, 57 counties increased enrollment by 10% or more. 68% of our customers in 2016 were new over 2015, and 22% of more Coloradans purchased dental plans. And that 68% is an interesting number to keep in mind. Once again, we are a marketplace for individuals and families that do not have access to employer coverage. They're not 65, they're not a veteran, and they make more money than the Health First Colorado. So there's a bit of mobility in that particular demographic. In other words, some customers that we might have enrolled in 2015 maybe got a job that had employer coverage. So that's why we see 68% of our customers are new. We are that place where where Coloradans can get coverage when they don't have access to employer coverage. There's more good news from 2016. 35% more of our customers are receiving financial assistance. And to us, that is very important. We know from some of our partners' data, there are still Coloradans who qualify for these tax credits and either don't realize it or have not accessed them. So we are working really hard as we prepare for Open Enrollment 2017, which begins on November 1st, to really outreach and educate, talking to media, talking to community groups, showing that income chart that I just showed you a moment ago, so that people can look at that and say, hey, I had no idea I could qualify for one of those tax credits, and then go ahead and contact one of our in-person assisters so that they can get that. Across the state, the average tax credit that that households receive was $294 a month. And they get that off their premium each and every month. They don't have to pay their full premium all year and then file their taxes in April and then get the tax credit back. Once their tax credit is determined, that tax credit comes off their monthly bill, and they write a check to their insurance company for the difference. So it really helps these families, these individuals and families, afford their monthly coverage. Enrollment by plan. Most of our customers enrolled in the Bronze plan, 75,000, almost 76,000. 73,000 enrolled in Silver plan. This is another opportunity that we are really kind of zeroing in on. Through some analysis by Wakely, a company out of Harvard, we know that some of our customers that are enrolled in Bronze plans, because they're maybe price point shoppers, it was the least expensive plan. If they enrolled in Silver, which is a little bit more per month, but when you consider their annual out-of-pocket health care costs, in other words, the number of the copay and deductible conversation, they actually would be paying much less total out-of-pocket if they picked a Silver plan. It's a complicated situation how this is set up, but it's important that consumers understand the difference between perhaps the lowest cost premium each month versus their total yearly out-of-pocket expenses. And that's where our health coverage guides, brokers, and application counselors are so critical in informing Coloradans. And by age, I think we do a pretty good job in Colorado of capturing the young, what we call young invincibles, at 26 to 34 year olds, but we continue to outreach to that group because, we're so happy to have brought the uninsured rate down along with our partner, Health First Colorado, to 6.7%. No, I don't think any of us will be satisfied until we get everybody covered. But we are happy to see that we're continuing to attract and reach out to young invincibles. So now we're getting ready and gearing up for 2017. Open enrollment will begin on November 1st, and we have our board has spent some time on focus areas and strategic planning, and from that came some focus areas assisting Coloradans to better understand their coverage and how to use it. And that really speaks to what I was just talking about. Understand that now you have coverage, now that you have insurance. Have you scheduled your wellness exam? Did you know that mammographies are covered at no additional cost and no copay? Things like that. We're trying to really let people see value in their coverage. Improving access to coverage in rural areas of Colorado. That's just critical. That's why we're so happy to have such a broad network of in-person assisters. Increasing the number of Coloradans taking advantage of the financial assistance. Again, as I mentioned, we know that there are people right now in Colorado who are paying full price for their premium and don't need to. And we want to make sure that we find as many of those Coloradans as possible because it'll make a difference in what their when their net premium is. And then reducing the complexity, improving the ability of consumers to obtain the right coverage for their needs. And that seems like that's quite a big task, and we understand that health insurance is complicated. But we do think by, once again, having this broad network of assisters in each community and each county across the state to begin to demystify health insurance and how to pick the right plan. And then to increasing the quality of our tools and services. And we've got a great new tool coming out. It's the Quick Cost and Plan Finder tool. I think many of you on this call will be learning more about, and if you hopefully will be attending Building Better Health conference in October, you'll be able to see it up close and in person. And we think that's going to be a tool to help us with all of these bullets. Open enrollment, as I said, on the individual marketplace will begin on November 1st, and consumers need to pick a plan by December 15th in order to have coverage that begins on January 1 and avoid that gap in coverage. And then the individual open enrollment will end on January 31. And just as a side note, the small business marketplace that I spoke about before, that's open year-round. So small businesses can get in and get their employees covered year-round. So that's another kind of important distinction. And in the news, you know, it's all of us, I think, care about the work we do. We think it matters, and I know it does. I hear stories every day from consumers that we're able to help. But we're also in an environment, it's an election year. There's all kinds of chatter in the newspapers and on TV about health care reform and Obamacare. But I think it's important to remember that it is working, and it is working for a lot of people. And here are some, I just pulled some headlines out of the paper and just copied and pasted them in here, just to let us, know that, yeah, there's lots of chatter, and yeah, we've got some things that we can work on, and hopefully we can work on with our legislature. But the Affordable Care Act has done a tremendous job in bringing access to coverage to so many people that never had it before, and the stories we hear are just compelling. Here's another slide that says, there's just so many good stories, and economically, as Nina explained, getting people covered is just an economic benefit to states, let alone improving the quality of life of our citizens. So with that, I think I'll turn it back to Liz, and I appreciate the time you all took today.
Great. Thank you so much, Linda and Nina. We are now going to begin the question and answer portion of the webinar. We have about 10 minutes. You should see the chat box area located in the lower left-hand side of your screen, and there you can type in and send your questions. There is that raise hand button, but like I mentioned before, we are not using that feature during this webinar. While we're waiting for some questions to come in, I am going to direct your attention to a few upcoming events. We have next Monday, there is a webinar from 2:30 to 3:30 p.m. where eligibility starts, and it's about modified adjusted gross income. The following Monday on October 3rd, again from 2:30 to 3:30 p.m., there's a webinar, a Communications 101 webinar, which is all about building communications into your outreach. And that webinar will set up two communication sessions at Building Better Health. And of course, the Building Better Health Conference is October 13th and 14th, and it's at the Crown Plaza DIA. So we do not have any questions in the chat. I'm going to give, so we do have a question here. And Linda, this question is for you. Are undocumented people required to purchase health insurance, and can they purchase it through Connect for Health Colorado? Linda, are you there?
Oh, yes, thank you. Sorry, I muted myself. That's a very good question, and sadly the answer is no. Connect for Health Colorado is only available to Colorado residents and people that are here with the correct documentation.
And another question for you, Linda. What is the penalty for 2017?
Right. That's another great question. I can see I missed some slides. That's a good question because the first year that this rolled out, the penalty was $95 per person, or 1% of your adjusted gross income. So some people thought, oh, it's too complicated, I'm just going to pay the penalty. Well, the penalty's gone up. It's now $695 per person, or 2.5% of your adjusted gross income, whichever is higher. So obviously our perspective is that people, that's pretty steep, and people, we just assume have them purchase health insurance and hopefully access a tax credit and have something for their money versus just paying this penalty.
All right, so we have another question for you. And so this question is that undocumented people are not able to enroll through the marketplace, but if they file their taxes, are they still responsible for the mandate? And Linda, I will share with you that if you are unable to answer that question, we do have some information being shared during the second day of the conference that will cover taxes. So if you are not able to answer this, I will make sure that that question gets through to our tax speaker.
Right. That'll be a great one to bring up at Building Better Health, because that is an important one and we need to get it right.
Okay. We have about 5 more minutes. Are there any other questions? So the next question is, are families not eligible for tax credits if an employee is offered insurance through their employer?
Okay, here's the way that works. If, let's just say, mom works for an employer that offers health insurance and pays part of her health insurance, offers it to the dad and kids, but does not pay anything towards the premium, that family is able to shop on our marketplace and pick a plan if they can find a plan that's less expensive than the employer one, but they are not able to access the tax credits. That's known as the family glitch. An example, the same family, let's say the mom works for an employer and the employer offers her coverage and does not offer it to the dad or the children because they're not paying for it anyway. They just don't offer it. The dad and the children can then get a tax credit through Connect for Health Colorado. So it's known as a family glitch, and it is problematic for those families. So I guess maybe just to simplify it a little bit, if families can shop for health insurance, even if the spouse is not offered, or even if the employer pays nothing for the spouse's health insurance, that they are not able to access the tax credit. Now, there's another sort of nuance to this, and that means that it has to be affordable. So if the employee's portion of the health insurance offered by the employer is more than 9.5%, then that's deemed unaffordable, and the employee can then shop on our marketplace and get the tax credit. But again, that's just the employee's portion, not the family portion. So the family glitch is another thing that is going to be really important to listen in on at Building Better Health, and to certainly talk to our local experts about.
So the next question is, can SHOP opt in for employee dependents?
Yes. The employer can design it however they want. They can design it for employees only, or for employees and dependents. That how it's set up is up to the employer at the beginning. That there are some requirements. They have to offer insurance to everybody, and they have to pay at least 50% of the premium. But other than that, it can be designed around the employer's needs.
Are there any additional questions? Okay, well thank you all for being on the webinar today. This is going to end our time together. Tomorrow, all of the participants will receive an email with a link to the webinar recording. Also, when you close out today, please don't forget to complete a short survey that will be available on your screen after we end the webinar. And your feedback is going to help us with future presentations, so we really do appreciate that. Thank you all for joining us, and we hope you have a great day.